Welcome, everyone, to the Preschool Neuroscience Summit. Today, I'm really excited to introduce you to Dr. Robert Melillo. Hope I pronounced that right. He is coming to us from New York. He's a specialist in childhood neurological disorders who works globally around the world. He's helped children from many different backgrounds, including dyslexia and OCD and ADD and Asperger's and many other disorders. So he's taught over 10,000 health and education professionals worldwide, and he has a practice in New York City. He's also the author of many books, including Disconnected Kids, Reconnected Kids, and others. So I think we'll hear a little bit more about those throughout the talk. So welcome so much. Thank you for coming and joining us on the summit today.
Thank you. Thank you for having me. I really appreciate it.
Great. So Robert runs the Brain Balance Achievement Centers in New York City. So can you tell us, what does it mean when there's a brain imbalance in children?
Sure. It's a bigger question than it seems. And it's also, we talk about brain imbalances, it's kind of a simplistic term. It's really a pretty complex thing, but we want to make it so that it's obviously understandable. But if I can summarize, essentially, this has been my 30 years of work and research, and it's been, a culmination of others. I head up a research lab. I've been a clinician and a professor and, graduate teacher for many years. And so the idea is to try to understand what's actually happening in the brain of somebody with ADHD or autism or OCD or Tourette's. What is it? And early on, I got involved with this because I had some personal issues with my own son who was diagnosed and labeled with some things. And that's what I wanted to know, because I had worked a lot with adults and at the time, and I really wanted to know, with this diagnosis, what was actually happening. I was already teaching neurology and clinical neurology and doing some brain research. And no one could really answer that question for me. And for me, that's the foundational question. And I often tell people and parents now, when you go to the doctor, ask them if they know what is actually happening in the brain. And most of them, if they're honest, will say, I have no idea. And so for me, because, to be able to say whether someone can't get better, or whether it has to be a lifelong disorder, or whether, you see people who are told that their children need to end up in institutions, and you don't know what it is, then it's really hard to make those statements, as well as you can't say that, certain treatments do or do not work if you really don't know, or what potentially causes it, or if we're seeing an epidemic rise in it. If you don't know what it is, you can't really answer any of those questions. So for me, that's where it was. So what I was able to discover, along with many other researchers around the world, is that what happens is that the problem that we see in kids, and one of the things that stands out, is that in all of these issues, they have this unevenness of skills, right? Any parent or teacher, anybody that works with us knows that you have these kids that are amazingly talented or extremely brilliant, or they have areas of their brain that are extremely overactive, like in hyperactivity or obsessive compulsive behavior or tics or stims or anger outbursts, or they have an overactive immune response, right? So we have areas of their brain that are functioning at above normal levels. And then we have other areas that are significantly delayed, where they're very behind or immature or deficient in certain skills, like being able to pay attention or nonverbal communication or social skills or being able to read basic material. And so this unevenness of skills, when I looked at it, having a background in rehabilitation, I looked at it as there's some sort of imbalance going on here. And what we see in rehab is generally when we have, overactivity in certain areas, like if a muscle is in spasm, it's often because another muscle somewhere is weaker than it should be. So I started looking at this in the brain and realized that in something like ADHD and autism, all of the things that kids were great at were left brain skills, all of them. Even things like hyperactive immune response, autoimmunity, food sensitivities, and all the things that they struggled, all of them were right brain skills. And dyslexia was the exact opposite, exactly. And this was coming from the best literature in the world, right? And so looking at that, I said, this isn't coincidental. There's something underlying this. So I teamed up with some researchers that had really, for decades, been talking about something called a functional disconnection syndrome. So what we know is that when I started jumping into this research in the 90s, since then, everything in brain research, whether it's mental health or education, even regular health issues, is all revolves around what we call functional connectivity in the brain. How the brain develops, how networks form, how networks communicate with each other through physical connections and through functional connections, basically tuning into the same frequency band. And so what research has shown was that the problems in these issues are where different parts of the brain and different networks can't connect with one another. They either don't form physical connections appropriately, or they can't tune into the same frequency band, so they can't talk to one another. And the reason why is because one side of the brain is immature or underdeveloped, the other side becomes overactive, and this creates this what's called developmental asynchrony or developmental imbalance, where certain areas of the brain are more mature, overactive, overconnected, and other areas of the brain are immature, underdeveloped, and underconnected. And they can't cross, and the two hemispheres can't speak to one another. So we end up with some symptoms and activities that are way too high, others that are way too low. And this affects every aspect of the body, from the immune system, the autonomic system, the hormone system, the blood sugar regulation, because the brain regulates everything. And that's basically what the problem is.
Yeah. Wow. Very interesting. And so interesting what you found about them being on either side of the brain. So you touched on this a little bit, Robert, but can you tell us in some more detail what kind of symptoms we might see when a brain is imbalanced?
Sure. Well, when we see symptoms, and again, not everything is a functional disconnection. Not everything is this functional developmental issue. There are people that have genetic issues that globally affect the brain and don't have any unevenness of skills. There are people that have brain injury, same thing. There are people that have psychological trauma, neglect, abuse, but even that often creates an imbalance in the brain. So not everything is that. And so how do you know if it is this kind of developmental imbalance or it's something else? Well, one is that unevenness of skills, right? When you have someone with, let's say, Fragile X or Down syndrome, or they don't have these unusually high skills somewhere, right? Or they don't have skills that are better. So the symptoms that we see, and when you look at ADHD, let's look at that as an example. Right? ADHD, attention deficit hyperactive disorder. So the symptoms come from both overactive, overconnected networks that are too strong with underactive and underdeveloped areas that are too weak. So the hyperactivity, the physical hyperactivity and impulsivity comes from specific networks in the left side of the brain that are connected with something with the prefrontal cortex and an area called the basal ganglia. These networks that control all aspects of human behavior, some of them are overactive. And that's where the hyperactivity and the impulsivity come from. Maybe even the tics or the stims, right? So that's the hyperactive. The attention part, there's 5 different types of human attention, and 4 of them are regulated by the right side of the brain. So when we see an attention deficit, we know there are specific networks like the dorsal attention network or the vigilance network in the right side of the brain that are underdeveloped. And so what we see is that the symptoms is a combination of overactive areas and underdeveloped areas. And together they produce symptoms, right? So that is almost always the case. Both sides are symptomatic, but the reason is there's an underdevelopment. The primary problem is the underactivity on one side that creates the overactivity on the other.
Right. Yeah, really, really interesting. And can this be corrected at all? And if it can, how do you go about doing that?
Yeah, well, in my own practice, I've worked with thousands and thousands of kids. And again, doesn't just affect kids, by the way. What I do, even though a lot of my research is revolved around children, this is what I call developmental functional neurology, which means there's been some research that has shown that looking at the childhood brain is important because what happens in the developing brain ultimately is the fate of the adult brain. So we know that most adult mental disorders, whether it's ADHD, which is the fastest growing problem in adults right now, depression, anxiety, psychotic events, anger issues, chronic fear, anxiety issues, all of these things are mostly started in childhood. And so if you really look at the history of an adult that comes in, their history usually goes back early on. And one of the things that we see with that is that many of these people they didn't really hit all their milestones appropriately. Like they didn't crawl, they didn't walk when they were supposed to. And that does matter. There's a lot of people coming out now saying that, no, it doesn't matter how you crawl, that you can crawl anyway, and that's normal because 50% of kids don't crawl in a normal way. So therefore, it must be normal. And the answer is no, it's not. That's why we're seeing an epidemic rise of these issues. And the fact is we're trying to normalize pathology, which is what we've been doing in a lot of areas, right? Which is why people are getting sicker and sicker and sicker. But a lot of this is also related to what we call retained primitive reflexes, which is an area I'm doing a lot of research on right now. I'm doing a PhD project with primitive reflexes right now, and that's really important. And so what we do know is that because most of these problems are not caused by genetic mutations, they're not caused by any injury or damage, there is no pathology in the brain, so there's no reason why you can't correct them. Now, autism and severe autism, there's what we call syndromic autism, which is connected with a genetic mutation, but that's only about 10%. 90% of autism, again, there's no genetic mutation, and it may be more difficult to normalize it, but kids with autism can be normalized. Some kids can be, but other than autism, almost anything else can be completely corrected. ADHD, we've shown in different studies that we have about a 90 to 95% success rate in our centers of completely correcting these issues, and we've worked with over 40,000 families and kids. So it's a large sample set, right? I'm not talking about a couple of hundred kids. I'm talking about tens of thousands between my own practice and the centers, and then the doctors that I've trained and therapists around the world. So yes, these problems can be, and I get, even just using my book, Disconnected Kids, I mean, I've given parents all the tools in that book, and many therapists and that's why it's sold over 500,000 copies, and it's now in 13 languages. And every week I get people that are just using what I did in the book, and they're correcting their child's problems permanently. There is no reason why they can't be. And anybody that tells you that they can't, again, they also can't tell you what the actual problem is.
Yeah, that's, wow, amazing. And so much hope, I think, for parents who maybe are struggling, looking for answers, or I'm sure it's great for teachers as well, just to see what's happening in a classroom. What kind of practical tips would you give, Robert, to the preschool teachers who are watching, or the parents watching who might have kids kind of in the under 8 age range, maybe 2 to 8. Is there something that they can do if they know that a child has, for example, ADHD or Asperger's in their classroom?
Yeah, first of all, I think, again, educating themselves is to really understanding. I think it's important. If you're a professional that works with children, you should try to understand what is actually happening and how to identify these children, right? So in my book, Disconnected Kids, it's written for the lay public, and it gives all the tools there to really be able to identify these issues, not only because I don't really care about the label, right? A label doesn't mean anything. I care about what's actually happening in the child and in their brain. So even things like, does the child have a head tilt to the right or to the left, right? To the right, then they usually have a right brain deficit. To the left, they usually have a left brain deficit.
Right.
And that can make a difference, meaning the way you approach them. Do you talk to them on the right side or the left side? Which side of the room is better for them to sit on, right? So if a kid has a right brain deficit, we want to do things to stimulate their right brain during the day. And so having them sit on the right side of the room, so they're looking at the teacher more through the left, is going to actually help them during the day. If they're on the other side of the room, that a lot of teachers will tell me, I have some kids, they come in, they're okay, but as the day goes on, they get worse and worse and worse and worse. And it may be because we're actually stimulating the wrong side of the brain as we're working with them. Which ear should you talk to them, or which side should you approach them to? I think they should also educate themselves about these things called primitive reflexes, because they are hugely important, and there are simple activities. There are simple ways to test for them, and there are simple activities that even teachers can do in the room that could be fun, like having children imitate different animal movements. And there's what we call developmental movements that, children will do things like a starfish or a lizard or a mule kick. And these things actually help resolve some of these primitive reflexes. And that is a big, big issue out there that almost nobody knows about. But you can read about it. It's fascinating. It's really fascinating. And it's, and understand that all of these things are important. But the most important thing to the developing brain is movement. And so getting the kids up to move and do things and do little exercises, or maybe even standing. A lot of parents that I'm working with now that have their kids home doing virtual school, I'm telling them, first of all, some parents actually have their kids allow them to lay in bed all day and do virtual, which is horrible, actually. Not the parents. If you don't know better, I'm not trying to, shame anybody, but it's horrible to let your child lay in bed all day. I had one kid that he got up out of bed and he passed out because he got what we call vasovagal, and he fell into a mirror, right? Thank God nothing happened to him. He did get stitches, but the kid was laying in bed all day, every day doing his Zoom classes, which is terrible, in his pajamas, right? So one of the things I tell parents is actually have your kids stand in front of the computer, right? Lots of times, like when I'm doing interviews like this right now, I'll stand. Yeah. And actually, if I find that I'm sitting all day, it drives me crazy. I don't feel good. And so what I like to do is either stand. Sometimes I have a treadmill in my office. I literally put this on a treadmill and we'll walk while I'm doing interviews or while I'm doing consults with people. It's really, you can incorporate those things into it. And, so I think that with teachers, maybe having the kids stand for part of the class, especially if a kid is really hyperactive, have them go to the back of the room and just kind of stand and don't, and do things, or have them do push-ups a little bit, or have them do jumping jacks. Little things like that are fun. But I think the main thing for a teacher is educate yourself about what's actually happening, and also try to recognize that diet and nutrition plays a role. Like if you see kids after lunch, they eat their lunch, they have a sandwich, and then that after lunch they're crazy. Maybe they have a gluten sensitivity, maybe they have a dairy sensitivity, maybe they have a food sensitivity that is triggering it. Or you see kids that come in and that they haven't eaten breakfast, or that they haven't eaten enough, they're fatigued, they're tired. Kids are not getting enough sleep at night. That's another big issue, the use of technology at night. is a big thing, like little kids have their phones next to them and friends texting them all through the night, or, the exposure to blue light after like 6 o'clock keeps someone up, so there's a lot of little things that teachers can really educate and educate parents, because a lot of parents have no clue. And to be honest with you, most doctors have no clue about most of this stuff.
Yeah, it's so important, I think, to keep learning and reading and try things out, right, and see what works. But I love what you said about the movement, because I think I see more and more research about as well of all the benefits of having kids moving during lessons, and like we're not meant to just sit for hours at a time, right? Especially young children.
Right. And why do you think we have an epidemic of these issues now? Because over the past 30 years, with the development of computer and technology and being more afraid to let our children outside, what we see is kids have become more, and adults have become more and more and more sedentary. And with that, we see this explosion of, mental health issues and educational and developmental issues. And that's the main driving force.
Yeah, really interesting. And what are some of the kind of latest research things that are looking interesting in the future that neuroscientists and people like yourself are diving into to learn more about?
The area that's really exciting right now, and that I think is really going to fuel a lot in the future, is, again, this area of functional connectivity and looking at functional networks. What we're realizing is, again, there's all these networks in the brain, like the default mode network, the salience network, the frontal temporal network, the sensory motor network, and how those networks develop, right? That's another thing, really looking at almost all of these issues are really just lack of appropriate development. They're usually not really genetic disorders or diseases or damage. And so how these networks develop, how they communicate with one another, and what can be done. So there's, like in my practice, there's some really exciting tools that we're using and developing. One is the development of what we call QEEG, which is a way of brain mapping, of really looking in a child or an adult, look at the brain. And the technology now is sophisticated enough, and the machines are relatively inexpensive that the average clinician can afford them. And we can really image networks. We can image connections on a 3D level in the brain in real time. You have to compare that to function, but you can really get a good idea what's happening. And then there's different tools that can be used, like transcranial direct current stimulation, transcranial alternating current. These are electric current that can be used right on the head to target specific areas and networks. Laser therapy that can be used to really change frequency of firing in the brain. Magnetic stimulation that can be used. There's also, I'm part of a company called SNA Biotech, where we're in a new emerging area called digital medicine, which is digital therapy. And so the first computer video game for prescription-only use for ADHD was just approved by the FDA.
Wow.
And we have created similar video games, but our video games are more targeting right versus left hemisphere. And we also have virtual reality. So we're going to be going through the FDA trial on that. And that's a whole new area of the FDA and of treatment and therapy. It's going to be huge, because most video games are really actually bad for the brain. Yeah. But we also know that software can change the brain. Mm-hmm. But you have to design it appropriately to be either. So if it can be damaging, it can also be helpful. Yeah. So we know that it's going to be big part of rehab down the road, and working with severe kids with autism, or, we can get them in front of a video screen and we can get them to play video games that actually help their brain. But at the same time, we can use like direct current stimulation. We can do bottom-up stimulation and top-down stimulation at the same time. So there's some really exciting stuff going on there, along with diet and nutrition and other things like, chiropractic treatment and osteopathic treatment. And, all of that is important. I think. And so the future is very exciting in that area. It really comes down to being able to use different tools to fine tune the frequency of firing in different networks and get them to tune in. It's like getting a walkie-talkie to tune in on the same channel, right? On the alpha wave or beta wave or gamma wave or things like that.
Yeah, wow. Fascinating and very exciting stuff coming up. So Robert, just before we finish today, where can people learn more about what you're doing if they've you've piqued their interest? I know definitely they can look at your books.
First of all, again, in the area of research, and especially if this is new to people, some people may say, I've never heard this before. How is this true? I just want to let people know that they were just completed a major study at Harvard Medical School and McLean Hospital, an independent study of my work that was done on ADHD. And it went on for a couple of years where they, did only a home-based version of what I do. And they based it on my book, Disconnected Kids, only the physical component and the sensory motor. So not the diet, not the cognitive, none of the behavioral, but only the sensory motor. And they did academic and cognitive tests before and after. And they had controls, and they also did very sophisticated brain imaging looking at this functional connectivity. And what they found was that the results of this 15-week trial with kids at home 3 times a week with the interactive metronome, another tool that we use, they had as good or better results than the best medication trials they've ever seen at reducing symptoms. But more importantly, what they showed on the brain imaging was that we created physical and functional changes in the brain that they've never seen before in any study that they've done for 30 years. And medication doesn't do that. And what they showed was they even said in the paper, the white paper they produced, that this basically completely confirms my theory that, by doing things that eliminate this bottom-up interference, that what it would actually do is targeting one hemisphere. It not only caused emergence and growth there, but it dampened the overactivity on the other side. And so that's a white paper that we can get to you that you can, send out to your people. They can read it. So this has been, all my concepts and theories have been proven independently at the highest level, #1 medical school, the #1 mental institution in the United States. But I have my website, drrobertmelillo.com, very active on Instagram. I post a lot of videos and show people how to do primitive reflex testing and exercises. So that's also at Dr. Rob Melillo on Instagram and Facebook. So those are areas that they can reach me, and they can get my book anywhere, Amazon, Barnes & Noble, any bookstore. Like I said, it's been translated, I think, into 12 or 13 languages now. It just came out in Spanish recently. And, I also have my practice in New York City, and I teach courses for professionals. It's online, also live. I've been teaching it in Atlanta. I just came back this weekend from teaching my course, and I'm teaching it also in Bulgaria right now, in Sofia, but I also teach in different cities around the world. And I'll be in Australia next year in 2021 teaching. And we're also in the Middle East, in Abu Dhabi and in Dubai. So, anybody wants to, if they have anybody, I'm in New York City, I have an active practice while I'm here. So if they go to my website, all of the information, all the products, all the courses, anything they need is there for them to get.
Great. We'll put all those links in Robert's speaker bio, as well as links to his books, and we'll get you that white paper once we receive it. But thank you so much, Robert, for coming on and sharing all that really interesting, fascinating research and practical things that we can do to help children with their brain development. It's really exciting, and the future sounds especially exciting with what it promises to help many, many children. So thank you so much for coming on and sharing with us today.
My pleasure. Thank you.